Welcome to this nutrition talk. I am so excited to be spending the next about 20 minutes or so with you talking all about 3 steps to reset your health. If we haven't met yet, my name is Nicole Aucoin, and I'm the founder of Healthy Steps Nutrition, home of CrossFit HSN and HSN Mentoring. I am a registered dietitian who didn't always start in private practice. In fact, I moved down to South Florida to take a job as a dietitian in a hospital. I knew I didn't want to work there forever, but I knew that would get me a lot of experience. And I realized firsthand how broken the healthcare system was. We don't have a healthcare system, we have a sick care system. And the hospital was like a revolving door of all these people coming back because they had these chronic diseases and they didn't have the support and what they needed to make the lifestyle changes to take control of their health. So I started a side hustle called Healthy Steps Nutrition. And today, that side hustle has helped over 50,000 people around the world. We have a podcast where we release episodes frequently, teaching people how to take control of their health one step at a time. And I am so excited to help you do this today, too. We have an HQ location down in South Florida, but we work with clients virtually. We also have thousands of gym owners and coaches that have partnered alongside us to use the Healthy Steps Nutrition Framework. So you can go to hireanutritioncoach.com and find a Healthy Steps Nutrition Coach near you. This is actually at the CrossFit Games, and you can see, although you can't see the exact success stories, there are people in this photo and pictures of them that have lost 100, 200 pounds. They didn't follow a super restrictive diet. They made health a way of life, and they understand how food and fuel and sleep and mindset and daily movement all connect together to move them closer towards their health and wellness goals. All right, so we are going to dive in today. I know that there's a lot of internet gurus out there, and I don't want you to take the success just from me. So, to give you a little bit of background, we again have helped lots of people. Here are 2 recent reviews. Ryan said, this has been a game changer for my physical and mental health. I'm so thankful for Amanda. Susan said that the things that she learned from Healthy Steps Nutrition gave her energy, helped her sleep better, and was way more than she ever expected. And I can guarantee that you're going to walk away with some simple, actionable tips today. All right. Our mission at Healthy Steps Nutrition is to help people prevent and reverse chronic disease. So we need to be on the same page with what is chronic disease. Greg Glassman, the founder of CrossFit, actually came out with this sickness, wellness, fitness continuum. And research shows that 60% of the population, so likely many of us listening to this nutrition talk and seminar, are closer to the sickness side. 60% of the US population has at least one chronic disease, and 40% have 2 or more. When you go to the doctor, they spend a few minutes with you and likely prescribing a medication when these numbers are heading over towards sickness. But I want to help you understand how you can prioritize your healthy habits, addressing nutrition, stress management, sleep, support system, mindset, so that you can move from the sickness side to wellness and ultimately over to fitness. When we're over on the sickness side and we get some type of illness, it can really put us down for the count. There can be more complications, but if we're closer to the fitness side, ultimately, we're harder to kill. And I think that we all want to live our best life. And in order to do that, we really need to take control of our health. So, what are those chronic diseases that I talked about that have 60% of the US population has at least one or more? The main chronic diseases revolve around cancer, diabetes, heart disease, that are some of the leading causes of death in the United States. 9 out of the 10 top leading causes of death in the United States are caused or worsened by elevated blood sugar. All right, I think we get the picture. We understand this is a problem, and we understand that we need to start taking action. I get a lot of questions about different weight loss medications and drugs, and ultimately, I think about it as a tarp. You have a roof leak and you're just putting a tarp, a medication over it, when we really need to address what's going on and address the roof leak, the lifestyle habits that are causing you to have those complications. And in this training, we're going to talk all about them. We're talking about the fundamentals of health, how to look at a holistic approach, and how to create your plan for success. All right, if you haven't done so already, make sure that you download the workbook that goes along with this training. It's really going to help you be able to take notes and take action. I don't want this to be just me talking at you. I want you to be able to take action. So, we are going to start off with a self assessment, which is the first part of that workbook. I want you to grade yourself A to F. This is for you. So be honest with yourself throughout the entire week, not just Monday through Thursday, the entire week. How are you doing in these areas? At Healthy Steps Nutrition, we focus on a holistic approach. Yes, of course, we address nutrition, but we also look at stress management, sleep, mindset, support system, lifestyle, because all of those factors are influencing nutrition decisions. There's so much misinformation out there around nutrition. I want to keep it so simple and practical for you. At HSN, we have three core principles. First thing, focusing on whole foods first. When most people think about diets, they think about taking things away, when in reality, let's just add more whole foods in those fruits and vegetables, nuts and seeds, and lean sources of meat. Let's add those in first. And then naturally, we will be cutting down the amount of ultra processed food and added sugar that we're over consuming. We want to focus on balance, pairing protein, carbs, and fats together. The majority of the population does not get enough protein throughout the day, and we need that to build and maintain muscle. So, by incorporating protein throughout the day, we are going to get closer to those protein goals that we need to maintain and build the muscle we're working so hard for in the gym. And also, when we're pairing protein, carbs, and fats together, it's going to help us stay full longer. I don't know about you, but I do not like to be hungry. Hangry is what we call it around here. I don't like that feeling, and I don't know many people that do. When we pair the protein, carbs, and fats together, we stay full longer. The third thing that we need to address is the amount of ultra processed food and added sugar. But the good thing is, when we're adding more whole foods in and we're balancing out our plate with half of our plate vegetables, quarter protein, quarter starch, we're naturally going to cut down the amount of ultra processed food. The plate method is such a simple strategy that you can use for lunches and dinners on the go at a restaurant or even cooking at home. I always recommend have those vegetables first, then have the protein, save the starch for the end. We want to make sure we're filling up our stomach with vitamins, minerals, fiber. Now, here's a fair warning. If you do not have vegetables on a regular basis and you go 0 to 100 with the plate method, you're probably going to feel some GI issues, some bloating, gas. We don't want that. That's a lot of fiber that your body's not used to. So we want to build up over time. This is where a nutrition coach can come in to help give you personalized recommendations. All right, we understand the nutrition component. We want to have mostly whole foods, balance, limiting the amount of ultra processed food. Go ahead and rate yourself A to F on the worksheet in that area. The next piece and pillar of our Healthy Steps nutrition framework is going to be mindset and stress management. This looks at how we are thinking. How are we talking to ourselves? How do we are we hanging out with a jerk all day? Are we really down on ourselves? How do we manage stress? Now, there's acute stress, which is actually good for our body, but chronic stress is actually not good for our body. It impairs our immune system, increases our risk for chronic disease. It causes us to have a hard time with weight loss. Have you ever gotten your cortisol levels checked? That's our stress hormone. And when we have high cortisol levels chronically, it inhibits our body's ability to lose weight. We store more fat. So we want to make sure that we're managing our stress, taking care of ourselves. Self-care is a big buzz topic, but it's really important that we take time to pause, have that intentional quiet time, to recenter, refocus ourselves instead of running on fumes 24/7. So, if you have, stress in your life, which we all have stress in our life, how do you manage it? Do we practice positive affirmations? Do we practice mindful stress management? Do we have intentional quiet time? Rate yourself A to F in this area. The next pillar is sleep. Now, sleep is so vital for optimal health, resetting our hormones, hormone health, weight loss, building muscle. Research shows that adults need 7 to 8 hours of sleep per night. You might say to yourself, Nicole, I am totally fine having 4 hours of sleep per night. The truth is what's going on inside of your body, you can't always tell. You might feel tired, but likely, we don't even know how our bodies are designed to feel if we're constantly running on fumes. What if you were supposed to feel better? You had more energy levels, you were able to think more clearly. Things like alcohol and sugar significantly impact our sleep. So it's not just laying in bed. How much good quality sleep do you have on a regular basis? Go ahead and rate that area A to F in your workbook. The next pillar in our framework is around exercise. We want to be exercising at least 30 minutes every day. If you don't have a gym membership or you're not used to exercising, go for a walk, a 15-minute walk after meals. This will significantly help you to improve your blood sugar after eating, help with energy levels, mood. There's so much research around going and walking outside in nature therapy throughout the day so that your body can have the sunlight, even for vitamin D. We want to make sure that we're having exercise 30 minutes per day. And we also want to be incorporating strength training too. There's a book called Forever Strong. Dr. Gabrielle Lyon wrote it, and she talked about how we don't have an obesity problem. We have a lack of muscle problem. People aren't getting enough protein that they need throughout the day, and they're not building muscle, and it's increasing your risk for chronic disease. And as you get older, this is more important than ever. We want to make sure that we're incorporating strength training and having that daily movement. The next pillar in our framework is support system. Now, if I'm honest, when I started Healthy Steps Nutrition, I did not realize how important support system was beyond besides me working with a client. I, yes, am a coach and a mentor to help clients take control of their health, but the truth is I'm not with them 24/7. Your coach isn't with you 24/7. Think about the people that you are closest to. Are their habits, is their lifestyle in alignment with what you are wanting for yourself? Research shows we're the average of the 5 people that we spend the most time with. Who are those 5 people for you? There was a story that I heard that was about two fishermen that were going crabbing. They were catching crabs, and one fisherman was throwing the crabs into a bucket, and the other one was watching this bucket fill up with crabs. And there was one crab that was trying to get out, and he said, "Hey, hey, this crab's trying to get out." He tells the other fisherman, and the fisherman goes, "Don't worry, the other crabs will pull him back down." I want you to think about that for a second. The other crabs will pull him back down. Sure enough, a few minutes later, the crab pulls, the other crabs are pulling that one crab that was trying to escape. And I think that analogy is so applicable to us as we are in different seasons of our life, and maybe our priorities are changing a little bit. And if the people we are hanging out with don't have the same priorities, they're going to try to pull you back. You want people that are pulling you up. You want to be a person that is pulling the people around you up. Are you that person for your inner circle? And are they that person for you? Support system is so important for you to maintain the results that you're working hard for. I think that's one of the huge benefits of CrossFit is that you get connected with a community that's all like-minded, working hard to prioritize their health and wellness. I think that's the magic and the stickiness of that methodology and why we love our community so much. They're all encouraging each other. And the truth is, for a lot of people that come into our gym, they don't have that community anywhere else. Maybe they have a significant other that's on board, or maybe they're not. But you need people to be supportive of your health and wellness goals. On your worksheet, there is an inner circle inventory. You can put an arrow up. Are those people pulling you up, or are those people pulling you down, or are they a neutral, not doing anything? Take a few minutes to really think about that. And if you have more people that are pulling you down, or maybe you need to take a step away from the people that are pulling you down and find someone that can pull you up and bring them a little bit closer to you. Your inner circle inventory is so important to maintain the results that you are working so hard for. Here are two amazing stories. This is Mary. She's actually a gym owner in the Northeast, and she lost over 200 pounds. Really incredible story. But she talked about, I had her on a Nutrition Made Simple podcast, and she talked about the importance of her mom and her community to maintain the results that she was working really hard for. Josh is a client of ours who did employee wellness with us for quite a few years through Delbrook, a construction company, and he lost over 100 pounds. Now, employee wellness is a really cool thing because when you have everyone that you're spending 8 hours a day with, or sometimes even more at work, all prioritizing their health and wellness, it's really easy to start changing the culture and get that good, solid support system. And he had that, and not then. He started helping others and he started paying it forward. Josh is an amazing story, lost over 100 pounds, not through a super restrictive diet, but understanding how to fuel his body, prioritizing exercise and sleep. And not only did it help him, but it also helped his family. Absolutely love his story. You can go to Nutrition Made Simple and check out his story there. Now, it all kind of comes together with lifestyle. Ultimately, my goal is to make it easy for you to make the healthy choice. Make the healthy choice the easy choice. And how I talk about this with clients is trying to get rid of some of the barriers that could throw you off track. If you have cookies sitting out on your counter, you're more likely to eat the cookie. But if they're not in the house, it's easier for you to not want to just go and mindlessly grab them. If you have healthy options for snacks and vegetables pre-cut up and protein options, and it's easy for you to make the healthy choice, the easy choice, you're more likely to do it. If you have an accountability partner at the gym, you're more likely to show up. It all comes together with lifestyle. And there's actually a lot of research around this. There was a big study done that showed people who prioritize their health and wellness and they have this healthy lifestyle, it brought them an additional 9 chronic disease for years. Now, if we go back to the beginning when I talked about 60% of the population has at least one chronic disease, that's towards the, as you get older, it's even higher. But if you're living an extra 9 chronic disease for years, that's towards the end of your life. That's likely retirement. And when you can travel more and live your best life and enjoy the things that you've worked so hard earlier. What were the biggest contributing factors? BMI, which looks at height versus weight. And we also want to take into account muscle mass there. Activity, exercise, 30 minutes of daily activity, alcohol intake. Research shows that alcohol significantly impacts sleep, but it also impacts your optimal health. And smoking was the other thing. When we look at BMI and weight, it's not just about the nutrition, while that is a huge component of it. It's also about prioritizing sleep and stress management and your daily movement. They all come together to help you manage your weight. I think so many people, when they think about weight loss or achieving their health and wellness goals, they think about a super restrictive diet. And in reality, they do all the things and then they fall off just as fast. So we want to make health a way of life by looking at this holistic framework, because ultimately we want to make the healthy choice the easy choice. All right, so we did step number 1, our self-assessment. Step number 2 is we need to look at that self-assessment and think about what is standing out for you. What's the one thing? Now, there's lots of different areas, and this is one of the reasons why our nutrition clients work with us for almost 18 months is the average length of engagement. The average amount of time a client works with us for nutrition, health, and wellness is about 18 months. If they're a gym member, much longer than that, but just our nutrition coaching clients, because there's always something to work on. But what's the one thing that you want to focus on? We just want to focus on one thing. Habit-based approach is so much more effective. Why? We can look at these 2 ladders, and if you climb up a ladder that has a lot of pegs, it's so much easier to climb up and stay consistent and not fall off the ladder. But in reality, what people think they need to do is make these drastic changes that are so hard to climb up and they just end up failing. Instead, we want to focus on the healthy habits. Habits are patterns of behavior that are ingrained to the point of automatic responses. Research shows that 40% of the actions that we take are automatic. Now, When we think about the automatic actions that we take, we get in the car and buckle our seatbelt, we brush our teeth. Those are the simple ones. But what about the nutrition and health and wellness ones? When we get done from work, is it automatic that we pour a glass of wine? Is it automatic that we fill up our plate with a bunch of carbohydrates and we miss out on the vegetables and the protein? What are the automatic habits? When we look at the population and how many people are having chronic disease issues, I would venture to say that many of the general population, our automatic habits are not in alignment with what we're wanting for our health and wellness goals. So, what do we want to do? We want to figure out what's the one thing, that one pillar that we are going to commit to. Research actually shows that when you focus on one thing, you're 80% successful to maintain that one thing. Focusing on two things, less than 30%, and three things, less than 5% success rate. It's no wonder that it's been tough for you to stay on track because you've probably tried to do too much at one time, felt overwhelmed, and then go right back to those old habits. Instead, stay consistent, track your progress, track your consistency with one thing at a time. You also want to take a look at non scale victories. So many people are so focused on the number on the scale when in reality, if we're exercising and doing the strength training like we recommend to build muscle, our body composition might be changing, but the number on the scale might not be changing as much. So we also want to look at these non-scale victories. How are our clothes fitting, our energy levels, our confidence, our sleep, our strength? How much easier is it for you to get up and off the ground? Can you go play with your kids at the end of the day? How's your mood? All of these things are so important, and our biometric data showing what's going on not only the outside, but the inside of our body. How is our blood work changing? The next step. So we did the self assessment, then we picked our one thing. Now we need to find our tribe. We talked about the five people closest to you, but there should be some different groups of people that you also are connected with. I can tell you that the number one reason why Healthy Steps Nutrition has grown at the rate that it has is because I have found people that were way smarter than me, that were many steps ahead of me, and connected with them, hired them as mentors so that I could learn from them. John Acuff, one of my favorite authors, we actually have had him on the podcast multiple times. He talks about it as borrowing someone's diploma. Why reinvent the wheel? Why try a bunch of things that don't work when you can align yourself with people that are many steps ahead of you that could help you fast track your progress so that you can reach your health and wellness goals much faster? You need a coach or a mentor. That's the first person that we need to look at when we're really excited and wanting to make a change. We need to align ourselves with people that are going to get there, help us get there faster. Then we need the cheerleaders, the people that are going to support us. Yes, a coach is there to support you, but a coach is also there to guide you. You need people in your circle, your five closest people that are cheerleaders there to pump you up when you're not feeling motivated, accountability partners. And we need some students. We need some people behind us that we can bring along with us and help them on their journey too. So, who is in your tribe? Who are the mentors, the coaches, the family, the friends that are there to support you? And ultimately, we need to figure out, why is this important to you? Why are you wanting to make the change? We need to tell that tribe why this is important to you, and most importantly, how they can support you on your health and wellness journey. All right. So maybe it was a little more than 20 minutes, but I hope that you have some ideas now to make health a way of life and understand that it's not just about nutrition. It's about prioritizing our sleep and daily movement and stress management. All of these factors are going to help you make health a way of life. Healthy Steps Nutrition has two podcasts. Nutrition Made Simple is the one that I actually mentioned a few times in this training video, where we provide simple and actionable tips. You can find that podcast in the worksheet and in the email where you're going to get the recording. So that is our Nutrition Made Simple podcast. If you are looking to help others become, if you're looking to become a nutrition coach, or if you're a gym owner looking to add nutrition coaching, Grow Your Nutrition Business would be a great podcast where we have free help just for you. Now, if you are looking for help and you are unsure where to start and you want to coach, you're tired of trying all the different diets and you're ready to make a change because you want to have more energy levels, lose weight, feel more confident, and have that accountability, you can go to healthystepsnutrition.com and book a discovery call, or you can go to hireanutritioncoach.com and find a Healthy Steps nutrition coach near you. Here's how it works. You're going to book that call. We're going to jump on a call with you to see what your goals are, see what you're wanting, and determine the best coach if it's at our HQ location to help you reach your goals. We have quite a few different dietitians on our team, and we want to make sure that we pair you up with the person that's going to be the best fit to support you on your health and wellness journey. You're going to work with them. We have a 12-week commitment for our nutrition coaching program, and you're going to have appointments with them. You're going to have weekly check ins. There's healthy recipes. There's going to be habit tracking and feedback and accountability with your coach every single day. Then you're going to own your health. And what do I mean by that? You can make informed decisions. You can have a plan that you feel confident that's not a super restrictive diet, but a lifestyle that you can live forever. So, if you're ready to get started, you can go to healthystepsnutrition.com and book a discovery today. I am so excited because we actually have a few different executive coaching options coming out really soon. And what this is going to look like is we've paired up with a concierge wellness service and a nurse practitioner and a medical doctor who I've known for a really long time. Ashley is actually the person who introduced me to CrossFit in 2010. And I'm so excited to be partnering with her to offer medical solutions. So she's going to order blood work and give feedback, and she'll be able to prescribe medications for you if that is what you need. But we're going to be able to do the coaching and the lifestyle interventions here at Healthy Steps Nutrition. So that's one route. We have a hormone health route too, where we have Dutch testing and cortisol stress testing, where we can provide more specified plans and programs to help people who want to dial in their hormone health. And then we have a continuous glucose monitor program where you wear a continuous glucose monitor and our coaches can provide simple, actionable feedback for you so that you can again take control of your health. So these executive coaching options, super pumped about them. The first 10 people that sign up for this option are going to actually get $300 off our executive coaching option. So go ahead and book a discovery call if that's something that you are interested in. And last but not least, I just want to leave you with this. I truly believe that health starts inside of the gym paired with a nutrition and wellness coaching program. The healthcare system isn't healthcare, it's sick care. And when we can understand how to fuel our bodies and prioritize our health and wellness in a simple way to make health a way of life, we are going to be able to prevent and reverse chronic disease. Our clients have seen amazing results over the years, losing 50, 100 pounds, decreasing their blood levels by 30 to 40% by taking control of their health one step at a time. So, if you're ready to take control of your health, we would love to help you at Healthy Steps Nutrition.